Calling the Health and Human Services Committee 1 o'clock p.m. agenda. Present with me is Vice Chair Senator Aquino. First, we have the 1 p.m. agenda and the 1:50 agenda for today. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business at 1 p.m. Monday, February 5th, conference room 225 and via video conference. For those on Zoom, your audio will be muted and video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify, so use your time wisely. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You will find a link on the status page for the measure. We appreciate your understanding and remind you that committee does have your testimony, that I review them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. And so unlike other committees, so for those who are new, we have 1 minute because we have a 2:30 end date, okay? So first up, SB 3122, relating to public health standing orders. First up, we have Department of Health in support.
Happy Aloha Friday, Chair, Vice Chair, Lauren Kim, Policy Chief for Department of Health. Thank you for hearing this bill. This is very important to us. This is an attempt to make preventive health, access to preventive health services a lot simpler, a lot easier, and less complicated just for everyday people. This is a bit of an experiment, calling it a public health standing order. It borrows from a medical concept. But again, the department is just really trying to find innovative ways to improve health without increasing cost unnecessarily. This is a work in progress. We would appreciate if this measure moves through. We have a lot more negotiation to go. Anything that's a new idea may be disruptive to the current system of referrals, and we would be grateful. We are engaging with our health system colleagues and partners to see if we can't make a go of this. But this is very important. Be happy to entertain any questions. We ask that you move this bill forward while we work on it. Thank you.
Okay, thank you very much. Next up, we have Scott Denny, Hawaii Academy of Physicians Assistants in support. We have Hawaii Public Health Association, Holly Kessler in support. Providing comments, we have Dawn Carisu of HMSA. Okay, they're not here. And next we have Hawaii Pacific Health, Michael Robinson providing comments, and Angela Melody Young providing in support. Anybody else wishing to testify on SB 3122? Seeing none, members, any questions? Seeing none, moving on. For SB 3124, we have relating to licensing, marriage licenses, civil union licenses, online access. First up, we have Department of Health in support.
Hello again, Lauren Kim, Department of Health. Thank you again for hearing this administrative bill. The COVID pandemic forced us to find ways to help people get marriage licenses despite social distancing and physical distancing. Out of desperation, we asked the governor for an emergency proclamation. It was granted, and we found that it works quite well. We have the infrastructure, we have the capacity. This is not going to cost any other money, and it's convenient for all parties involved. So we ask that you move this bill forward, and I'm available for questions.
Thank you very much. Next up, Angela Melody Young for CARES and support. Next up, Ben Robinson in opposition. Members, any questions? Seeing none, we're moving on. Next up, SB 3127. Relating to nuisance prevention. Okay, another, first up, Department of Health and support.
Good afternoon, Chair, Vice Chair. My name is Matthew Carano. I'm the Administrator for the Environmental Health Services Division. We stand on our submitted testimony. Thank you. Any questions?
Okay, thank you very much. Okay, no one else having registered. Anybody else wishing to testify on SB 3127? Seeing none, members, any questions? Next up, SB 3128. Oahu Regional System, trying to repeal what we did 2 years ago. First up, we have Department of Health and Support.
We'll stand on a written testimony and support.
Okay, next we have, I see Sean Sonata here, in support, Oahu Region.
Good afternoon, Chair, Vice Chair, Sean Sonata, Chief Admin Officer for the Oahu region. Our support for this centers on two primary things. First of all, the cost. We don't think the investment of 10.3 million, which probably went up in the time since the estimate was made for transitioning, in addition to the anticipated 5 million a year to support the Oahu region's transition, is justified just because of the fact that it won't come with any additional services. Second is a big part of the reason why we were going to transition was because we had some space that we wanted to use for public benefit programs. And in the time since this act was passed and enacted into law, we did in fact come up with good plans to use all of the space, not only with the Department of Health, but also with other agencies like the city core program. And we believe that because all of our spaces are appropriately occupied and with plans to use them, which we can show you in even more detail later, Chair, the intent of Act 212 is essentially satisfied in large part because of our efforts over the past several years. And for those reasons, we think that repeal is probably appropriate at this time.
Okay, thank you very much, Sean Sonata. Okay, next up, we have Edward Chu, Hawaii Health Systems Corporation and support.
HHS will stand for the testimony and support.
Okay, anybody else wishing to testify on SB 3128? Seeing none, members, any questions? Okay, so I've got a lot of questions on this one. Department of Health, any Lauren Kim, Marion Suji, and maybe Edward Chu. Why don't you both come on up? Okay, so I looked up Act 212, and maybe Sean Sonata, why don't you come on up, all three of you folks. So I was not health chair at the time Act 212 was passed, but I was cognizant of it as House Chair of Human Services. And Act 212 appropriated a lot of money. $200,000 and $16,320,700. So what happened to the money? You guys got it?
Yeah, so the Oahu region did receive that money. The money for that money was basically for operations for that fiscal year. It wasn't part of the state budget. It was supposed to be for funding their operation for that year. So that money was used to fund their long-term care operations at Liahi and Malahia. So that money's spent.
So
It's not for transition.
right, it wasn't for transition. Ordinarily, our budget in prior years was combined with the HHSC total request. But from that year on, we had our separate program ID. So the funds that went into that was just for our operations, our operational subsidy for that given year. The money to transition would have been an additional 10 point something million to complete the transition and an additional 5 or so million each year after that, just to maintain it under the Department of Health.
And that was part of the study, I remember that.
Correct.
Right.
Okay, because I'm just telling you, the purpose of the act was that those money was supposed to, I'm gonna quote, appropriate monies for the mental health substance abuse special fund to formulate and execute a comprehensive business and transition plan. And the appropriate monies from the funds, which is the 16 point something million, to transfer, not for operation, to transfer the Oahu Regional Healthcare System from Hawaii Health Systems Corporation to the Department of Health. So basically, you folks are testifying that you did not use the monies, almost $16.5 million, for what the legislator intended the monies to be used for.
If the language reads in that fashion, if that money was used solely for transition, we would have no operations during that year because we did not make a request at all for any operational funds. And so our understanding of the appropriation was just that it's funding our operations for that year because we're not asking for it under the same umbrella as HHSC and the other regions.
Okay. You know what, I'll admit I wasn't health chair at the time and I did not sit in FIN or WAM at the time, but so I will ask the appropriate chairs as to the purpose, but that is what the act as signed by the governor said the monies was supposed to be used for. Okay, second, according to my memory and what it was testified to, the reason the legislator wanted the transition from Oahu Regional Healthcare, not only for the use, and thank you for that, Sean, the testimony that you folks are going to completely use it, was because there really was no intermediate care between Hawaii State Hospital and I guess the street, and I guess regular hospitals. Right now, how much does it cost to house a patient in Hawaii State Hospital? Do you know?
It's about a little over $1,000 a day.
Yeah, over $1,000 a day. And during the WAM briefing of HHS, not HHS, of Department of Health, I remember Dr. Luke testifying that 1/3 of those beds, about 140 beds that were being used, could actually be patients that could be transferred, hopefully, to something intermediary.
Yes.
But there is no intermediary care. That means that the kind of what Sean Sonata testified to, the subacute, low acuity patients. Does the Department of Health have any plans to create this intermediary care so we can offload 1/3 of those patients?
So we're not sure that we could offload all 1/3 of those patients, but we are putting out an RFI shortly to look and see what might be available in the community so that we could perhaps contract out.
Okay, so you know what, it's probably something that could be done off hearing, but this has been a long-standing request by the legislator that predated you, Marion, and predated you, Edward Chu, but you've been around, Sean, okay? and Lauren Kim has been around, that we needed this intermediary care, okay, because Queens needed to offload all of their ER people, and state hospital is costing 5 times the cost of prisons, that there needs to be a plan, yeah. Okay, and basically that's it. Any other comments, questions, concerns? Thank you. Next up. We have SB 3138. Relating to manufactured hemp products. First up, we have Department of Health and Support.
Good afternoon, Chair, Vice Chair, committee members. My name is Greg Edwards with the Office of Medical Cannabis Control and Regulation. We are in support of this measure. This measure we respectfully request a small but very important change to this definition. It'll allow us to move forward in rulemaking to consider new products to the current list of allowable products, hemp products. Without this change, we can't move forward on the rulemaking to even consider new products.
Okay, thank you very much. Next up, we have Department of Agriculture providing comments.
Chair, Vice Chair, and members of the committee, Leo Obaldo, Administrator of Validations Division, Hawaii Department of Agriculture. We stand on our written testimony offering comments, and the comments that the Department of Agriculture regulates buffer zones of hemp farms and transport of hemp materials, but Department of Health regulates the hemp products. So we're deferring to their comments. Thank you.
Okay, thank you very much. Next up, we have Mike Lambert, Honolulu Police Department and support.
Yeah, we stand on our written testimony.
Okay, thank you very much. Next, we have Kirsten Walker in opposition. Anybody else wishing to testify on HB 70? Seeing none, members, any questions? Okay, seeing none, moving on. SB 3139. First up, relating to crisis services, Department of Health Crisis Intervention and Diversion Services Program. First up, we have Michael Champion, Office of the Governor in support. Dr. Champion.
Stand on written testimony supporting intent. Thank you.
Okay, thank you very much. Next, we have Hawaii State Department of Health and support. No, I thought I did that, HB 7. Oh, I'm sorry. We'll finish this one. Thank you. Thank you.
Good afternoon. The Department of Health would like to stand on its written testimony. We'll be here for additional questions.
Okay, thank you. Next up, we have DCAB, Kirby Shaw in support. Next, we have Rod Miley, Judiciary in support. Alan Johnson, Hawaii Substance Abuse Coalition in support. Wesley Munn, testifying for United Self-Help in support. Thank you very much. Okay, next we have Olivia Chan, Community Alliance on Prisons in support.
Good morning, or good afternoon. We strongly support this bill and prefer the language in this bill over the language in SB 2246 and SB 2345, which authorizes another law enforcement officer instead of a mental health emergency worker. Thank you.
Okay, thank you very much. Next, we have Louis Urchik, Hawaii Disability Rights Center, providing comments. Next, we have J.C. McCulloch, Queens Health Systems, providing comments.
Stand on our written testimony, Chair. Thank you.
Thank you. Next, we have Shayna Kukila in support. Shayna, please proceed. You have 1 minute.
Aloha, Chair and committee. This is Shana Kukila from Hilo, Hawaii. Just wanted to stand on my testimony in full support, but also that request that the Department of Corrections and Rehabilitation be engaged and included in this bill as a partner. And also, I wanted to thank the introducers of this bill, because in Hawaii County, we are actually speaking with the mayor, and they are talking about crisis service for the disabled as well. So thank you very much for your time and allowing me to testify.
Okay, thank you very much. Next, we have Julie Shinsato in support. Okay, anybody else wishing to testify on SB 3139? Members, any questions? So I have a question. I see Marion Suchi here. Could you come on up for Department of Health? Okay, I know that this is a Department of Health priority, but we also have on the 3 o'clock calendar a similar, oh, thank you for coming on up.
Yes.
Also, a similar bill, which I believe is relating to behavioral crisis centers. Right, SB 2246. Are they in conflict if we pass both with amendments?
Chair, there are many bills relating to crisis. And so we'd like to be able to
Figure
take
it out by conference?
yes.
Okay, do you agree? So I'm
We'd like to be able to
keep moving.
evaluate
Which ones?
and then provide you with some recommendations.
Okay,
There's an overlap in
I understand.
many.
Yes. You agree?
Yes.
Okay, so that's my inclination, is to pass all and then figure it out prior to conference, which would help without overlapping funding.
Thank you.
Okay, thank you very much. Okay, SB, anybody else wishing to testify on SB 3139? Members, any questions? Okay, we're moving back. My staff remind me I missed the bill and I apologize. So HB 70, regarding we're moving on back to HB 70 relating to controlled substances and products. Again, Uniform Controlled Substances Act, Schedule 1, cannabinoids Delta 8. This came from 2023 calendar. Apparently it's still valid. So first up, we have Department of Law Enforcement in support. Thank you very much. Next, we have Department of Health providing comments.
Chair, Vice Chair, committee members, Greg Edwards again with Department of Health. We offering comments. We respectfully ask that the language in Section 1 be removed. Last year's Act 263 with the legislature passed and was enacted already now addresses the concerns that Section 1 is addressing. It's no longer necessary.
So did you put that in your written
Yes.
testimony?
Yes.
Okay, good. Okay, next we have Captain Lambert from HPD in support.
Stand on our written testimony.
Okay, thank you. Kirsten Walker in opposition. Anybody else wishing to testify on HB 70? Seeing none. Okay, we're moving on to SB 3141. Relating to mental health, requires Department of Health to track and publicly report certain data relating to crisis reports, emergency mental health transports, assisted community treatment. First up, we have Hawaii State Department of Health and Support.
Good afternoon, Chair. This is Courtney Matsu, Medical Director and Acting Administrator for Adult Mental Health Division. The Department of Health is in support and stands on its written testimony. We already do much of what's listed in the bill. Thank you.
Okay, thank you very much. Okay, next up, we have Hawaii Substance Abuse Coalition in support. Next, we have Institute for Human Services in support. Next, we have J.C. Mikulinek, the Queens Health Systems, providing comments.
Sure, we'll stand on our written testimony.
Okay, Hawaii Disability Rights Center providing comments. Anybody else wishing to testify on SB 3141? Members, any questions? So I have a question. Department of Health, come on up. Okay, so we passed this. You track and publicly report the data. Who are you reporting it to? And how does other mental health providers, how are they going to be able to access this?
I'd like to call your attention to, there is a data dashboard that is online called bh808.hawaii.gov, and that's where all the data is publicly available.
Okay. So is it, if it's already publicly
It's live, yes.
If it's already publicly available, why do we need this bill? You don't need the bill. You don't need the bill? It's a Department of Health priority according to my list.
We, within this bill, there are recommendations or the request to collect crisis data. And as we're moving forward with developing a behavioral crisis center, this would be help us to further along that initiative by collecting data from this new facility and for future, if we do expand it to other counties.
Okay, is there any, if we pass this, is there any plans to use the data and put it in as part of the other information Hawaii Health, excuse me, there's this database, I don't remember the name, I think you know what I'm talking about. Is there any plans to integrate it so that we don't have like multiple databases?
That would be best, yes.
Should we amend this bill to, or are you guys going to be able to do this with regs? You don't know yet.
I'm not sure. I'd have to get back to you on that.
Okay.
Thank you.
Anybody else wishing to testify on SB 3141? I see Shana Kokila. I apologize for mispronouncing your name. So Shana Kokila, you have 1 minute.
Mahalo, Chair, no problem. I was actually born with that name, but it changed to Shauna. So you're actually right. But however, I want to just support this bill and also say you know, the nuances in the bills are very important. So we want to make sure that we call them crisis intervention instead of mental health, because there's a lot of nuances to those. I think that you could find a lot of information from resources such as NAMI to properly identify those in crisis, because some are developmentally disabled. And so they're not having a mental health crisis. These are behaviors that are caused by other things. So we want to make sure that we properly identify. But also I have 2 data requests. One was, how many involuntary commitments are there already by the Department of Health or others? And what are the evaluation process of the program that for involuntary commitments to treatment? Because as a parent of an adult who is homeless in Hilo, I don't know how to help him because he's drug addicted, and they do have a detox center that just opened thanks to BISAC, but how do we get them there? And how does the Department of Health assist us? Thank you for your time.
Okay, thank you very much. Anybody else wishing to testify on SB 3141? Members, any questions? Okay, I have a question. Shauna, are you still there?
Yes, Chair.
Well, Department of Health testified that there's already a dashboard. Behavioral Health 808, are you able to access that?
Yeah, my question is about involuntary commitments. So how do we get our family member who can still determine they don't want treatment and refuse treatment? How do we get the Department of Health to force them into treatment if they're on the street and endangered?
Okay, so thank you. I think this is just data collection. There's another bill regarding crisis intervention.
I'm sorry, I guess I'm just saying that the data collection should look at how valuable that kind of program is and how effective it is.
Okay, thank you very much. So, Department of Health, you heard the question. I mean, does the Behavioral Health 808, that the dashboard you referred to, does that include involuntary commitment numbers?
Not yet.
Pass this bill, is it going to include all those MH1s? And
So we certainly collect copious MH1 data provided by the MHEW people and police. Regarding issues like civil commitment, which happens at acute psychiatric facilities and the Hawaii State Hospital, as well as the proposed data gathering for the ACT Act orders, those are very hard to collect because those mostly come from the private hospitals like Queens and Adventist. We could certainly easily collect the civil commitments, denied civil commitments, and ACT requests at the state hospital, but we'll have to figure out some way to share data or have data shared with us from Queens, Castle, Kona, all the psychiatric hospitals.
Okay. Did you hear her answers regarding whether or not we could eventually integrate this into the database that is already existing?
Yes.
Do you folks have plans for that?
So those.
If we pass this bill, because that's there's another bill that SHPTA wants regarding a more robust data gathering database. And because I'm concerned about funding multiple databases, okay? That only certain people can access certain databases. It sounds like to me we should have one database that's accessible to providers.
That would be ideal, yes. I think at least for our database, we have to work closely with other agencies to get some of the information. And so it will require a lot of coordination with other folks, but yes, you're correct that having one database.
So I'm thinking, frankly, this bill isn't ready yet. I'm just letting you know, we'll talk later.
Thank you.
Okay, any other comments, questions, concerns? Seeing none, we're gonna move on. SB 3142. Relating to water infrastructure, drinking water treatment, revolving loan fund, water pollution control. First up, we have Ulupono Initiative in support.
Good afternoon, Chair Sam Buenaventura, Vice Chair Aquino, members of the committee. Micah Munikata here on behalf of the Ulupono Initiative. We stand in our testimony in strong support of this measure. Chair, this measure is not asking for funds. It's just a tool that allows DOH to respond to community needs for various projects, infrastructure projects critical to the safety and health of our various communities. It is that tool that can be used to respond to crises such as Red Hill and the Maui fires. Chair. So appreciate you hearing this measure and thank you very much.
Okay, thank you very much. Next up, we have Department of Health and Support.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Joanna Cito. I'm the Environmental Management Division Administrator. The department stands in strong support of this bill. I will be here for any questions.
Okay, thank you very much. Anybody else wishing to testify on SB 3142? Members, any questions? Okay, I'm going to recess for decision making. Okay, first up, for decision making, SB 3122, Chair's recommendation is to pass this with amendments. We are going to put a defect date on it of December 31, 2050 to ensure further discussion and tech amendments as needed. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, Chair votes aye, Vice Chair votes aye. Senator Keokalole.
Aye.
Senator Shimabukuro.
Aye.
Senator Awa is excused. Recommendation is adopted.
So for SB 3124, Chair's recommendation is to pass as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, passing unamended. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 3127, Chair's recommendation is to pass with tech amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, thank you very much. With amendments, 4 members are present. Any reservations? Any noes? Recommendation is adopted.
So for SB 3128, I have major concerns regarding this because it doesn't sound like to me Department of Health has a plan, nor the working group required by Act 212, where Department of Health is chair, to create this intermediary crisis center. And there's also questions to me as to whether or not it was legal for HHSC to use the 16-point-something million provided for by Act 212 specifically for the transition to be used for operations. So we're going to defer this indefinitely. Okay, so for SB 3138, Chair's recommendation is to pass with amendments, with tech amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, thank you very much. 4 members are present. Any reservations? Any noes? Recommendation is adopted.
So for HB 70, Chair's recommendation is to pass this with amendments. We're going to amend Section 2 for Department of Law Enforcement's request and remove language on Section 1 per Department of Health testimony. And we're also going to keep, we're going to change the defect date to December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SB 3139, as the testimony has shown, there are various bills to try to address the homeless as well as the behavioral health crisis that is occurring in the state. So we're going to be passing this. This was a Department of Health priority. We're going to accept the Hawaii Substance Abuse HSAC's amendment to Section 2. We're also going to accept Department of Health's amendment. We are going to remove the $6 million request, put in a blank appropriation, but in the committee report, we are going to refer to the $6 million request by Department of Health. Because there are substantial amendments, we're also going to add in a defect date of December 31, 2050, so that we could determine which, if any, or all of the various similar bills should proceed to the governor's desk. Any comments, questions, concerns? Seeing none, pass with amendments, chair votes aye.
Okay, four members are present. Any reservations? Any noes? Recommendation is adopted.
So for SB 3141, I don't think this is ready. We're gonna pass this anyway with tech amendments. We're gonna put in a defect date of December 31, 2050. I am gonna let the advocates know, which I know it's a Department of Health priority, that another Department of Health SHPTA has a similar bill regarding collecting health data. And there's going to be also another resolution for health data. My inclination is to pass one bill eventually after conference or resolution for a single database that will be shared. Okay, so probably the resolution, but we'll keep the conversation going by passing this with amendments in a defect date of December 31, 2050. Vice Chair for the vote, chair votes aye.
Okay, four members are present. Any reservations? Any noes? Recommendation is adopted.
So for SB 3142, Chair's recommendation is to pass with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, thank you very much. Four members are present. Any reservations? Any noes? Recommendation is adopted.
Okay, we are adjourned. Thank you. Calling the 150 Health and Human Services agenda. Present with me is my Vice Chair, Senator Aquino, and Senator Miley Shimabukuro. This meeting is being streamed live on YouTube. In the unlikely event we have to abruptly end this hearing due to technical difficulties, committee will reconvene to discuss any outstanding business at 1 p.m. February 5th, conference room 225 via video conference. For those on Zoom, your audio will be muted. Video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You will find a link on the status page for the measure. We appreciate your understanding. Remind you that the committee does have your testimony. I reviewed them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. So for SB 2837, relating to the Oahu Regional Healthcare System, Hawaii Health Systems Corporation. First up, we have Bruce Oliveira, Department of Defense, in support. Please proceed.
Good afternoon, Chair. Bruce Oliveira, I'm the Interim Director for the Office of Veteran Services, Department of Defense. Just to briefly highlight what I've talked about in my written testimony, is that the construction of the Maui Veteran Home is currently being undertaken by our department. However, the DoD doesn't have the capability or the expertise for continued operational oversight of a long-term care health facility, and requires the transfer of the Maui Veterans Home to a state entity that has that capability to continue with long-term care. And that state entity, I mentioned in my written testimony, could be the Oahu Board, because they've already stepped up to that. And then they've also said that they can be a placeholder until someone else comes in.
Thank you very
Okay,
much.
all right, thank you.
Next, we have Hawaii Health Systems Corporation, Ed Chu, in support.
HHS will stand on its written testimony to support, supporting the intent.
Okay, thank you very much. Next, we have Sean Sonata, Oahu Region Center, in support.
Good afternoon, Chair, Vice Chair, committee members, Sean Sonata, Chief Admin Officer for the Oahu Region. The Oahu Region supports the intent of this measure just because of the high need for this facility on the island of Maui. We were approached and informed that there does not appear to be a state entity that is able to facilitate this because of the prior transition of the Maui facilities into the Kaiser system. For us, we support the intent of having this facility, and we're willing to step up if called upon. We don't have any intent to trample on the jurisdictional rights of another region. We just want to help.
Okay, thank you very much. Next, we have Randy Pereira, Hawaii Government Employees Association, in opposition.
Good afternoon, Chair. Very quickly, we want to be clear, we totally support the purpose involved in trying to build a facility because there is a need. But we find this to be very illogical, having been beat up many years by your predecessors from Maui about not having an Oahu-centric model of care. We feel that the Maui Regional Board should be the group that's responsible for oversight here. And frankly, we believe that the legislature should hold them accountable and not just force this back on Oahu. I don't think the Maui community would support having Oahu be in charge of this. Thank you.
Okay, thank you very much. Next, we have Thomas Driscoll in support.
Chair Thomas Driscoll, also an employee of OBS. This particular bill is essential for the establishment of a third veterans home on Maui. Without the proper authority to oversee that facility, we cannot go forward with that project. DOD is unable, as General explained, to do that. As far as OVS, DOD, we are concerned, it doesn't matter if Oahu region oversees it, or if Maui region oversees it. Arguably better if Maui could oversee it, but somebody's got to oversee it. And if we can't get this definition of authority put into the legislated language now, then we don't have the ability to go forward. So we're hopeful that you can pass this bill forward and leave the door open. This morning, I spoke to Avery Chumley on Maui, and as the current chair of their board, he agrees they are interested in pursuing this initiative.
Thank you very much.
Thank you.
Okay, anybody else wishing to testify on SB 2837? Members, any questions? Okay, I have a question. Bruce Oliver, come on up. So, what happens if this bill doesn't pass? Because I know the House bill did not.
If it doesn't pass, then it's going to delay what we need to do for another year. Our intent was to get this bill passed now and then be able, the next session, to come for the money for the construction of the state veterans home. If we don't have this now during this session, then it's just going to push everything back one more year.
So you can't ask like next year for the authority and the money at the same time?
When I was sitting down talking with the Adjutant General, General Hara, he didn't want to go forward until we had the money. I mean, not the money, until we had the authority. And I think he's going to want the same thing in order for him to go to the governor and say, we have one more thing that we're working on, and that's the land, but we have more time for the land. The authority is what we really need for this session in order to go forward for the next session.
So once you get the authority, the idea is to start planning it and make the request?
Yes.
Okay. Thank you.
Okay.
Any questions of Drew Sullivan? Okay, I have a question for Edward Chu. So the Maui legislator, Maui senator introduced this bill. So I'm assuming Maui wants it. Is there a Maui regional HHSC?
Maui region in statute still exists.
Are there people?
Well, that's the issue. So by the statute also requires that a regional board must have at minimum 6 members. Right now, the Maui Regional Board, I believe, has 2 members. Avery Chumley, as you mentioned, as the chair, and then one other person. So in order for them to be a functional board under our statute, they will need to have at least 4 more members. They have not met since, I believe, about 2019 or 2018. So the regional board has not had a meeting.
So it's not a functional board.
It's not really functional at this point, according to our statute. So that's the issue that the Maui
So what happens if we pass, well, I don't think we can because the title says Oahu. What happens if we insert language saying it's the Maui Regional? I mean, and there's no functioning board.
The Maui Regional.
Can they still function? I mean, can you come back up here, Bruce?
They would have the Maui regional, all regional boards are self-perpetuating. So, they're the ones that determine how many.
So I mean, will you folks be able to move towards getting the Maui Veterans Home, and instead of, if we put in language regarding Maui Regional Center, I think we can make a reference to it, but then we can't. But we have to acknowledge Oahu because Oahu is on the title of this bill.
If Maui is functional and.
Well, it's not functional according to him. But I mean, what happens, because according to Sean Sonata, they're gonna be a placeholder anyway.
Right, so we can do that. We can do that as a placeholder until the Maui.
And there won't be the 1-year delay.
No, then there wouldn't be a delay.
Okay, thank you. So do you folks have any questions of Edward Chu or Bruce Oliver? So I have a question of Randy Pereira. Come on up. There's not a functioning Maui Regional Center. And aren't the employees of Oahu region already in HGA?
Yes. The people that work for the hospitals.
Like Leahi and Maluhia?
HGA and UPW, yes.
So I don't see why we can't put them in as a placeholder with the idea of considering moving it to Maui as soon as they become functional so that they can move on and we don't have this 1-year delay.
Well, I suppose you can, Senator, but my testimony, as I wrote, is that up front, this doesn't pass the smell test to be seeing Maui legislators who for 20+ years beat the crap out of me at tables like this about not wanting Oahu controlling their healthcare.
Yeah.
So it just stands to me as illogical that today these similar Maui legislators, their successors, are now falling over themselves to try to support Oahu taking over out of just what they perceive to be expediency. Besides, I would also argue that, as was just testified, the boards, thanks to Senator Rouse Baker and people like Avery Chumley, are self-perpetuating. They should be functioning because part of their responsibility is to be oversight of Kaiser that operates Maui Hospital right now. They're apparently failing in their statutory responsibility there. And I would anticipate that if this legislature be the only body that is able to hold them accountable. So on its face, as I said, we don't object to some means to try to move this project forward, but it just doesn't make sense that without efforts to force Maui to take over responsibility, it's just not logical considering history as to how this issue has evolved.
Okay, thank you very much. Any other comments, questions, members? Seeing none, okay. We have 4. Okay. I am ready to do DM. All right. Okay, so for SB 2837, Chair's recommendation is to pass this with a defective date. It merits further discussion. It sounds like to me we need to somehow amend this prior to conference to take into account that the idea is to have the Maui Regional healthcare system of HHSC eventually get resurrected and take over Maui Veterans Home when the time comes. And any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay.
Oh, sorry.
You didn't say the effective date.
Oh, the effective date is December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, passing with amendments, Chair votes aye, Vice Chair votes with reservations. Senator Keokolole is excused. Senator Shimabukuro.
Aye.
Okay, Senator Awa is excused. Recommendation is adopted, Chair.
Thank you. We are adjourned.